Hi, good evening. Today we are here to talk about sleep disorders or how to fix, not disorders actually, we are here to talk about how to fix common sleep problems because sleep is one of the most important things that our body and brain needs. Today I'm not gonna, I'm not collaborating with anyone, I'm doing it by myself because I thought I have so much information to give, so it will be very difficult to have a conversation with someone else. It's better I do it by myself today because sleep is a big topic. I don't think so I can cover a lot of things in one day. Maybe if it goes well and if I'm able to help some of you, I don't mind doing another live about sleep disorders. Meanwhile, feel free to ask questions. I did get a lot of questions about sleep, mostly very repetitive, but I still have a lot to talk about for today. Yes. So let me start with what are the common symptoms that people feel when they have sleep disturbances. What are the common things that I get to hear in my OPD when patients come to me? One of the first things is I feel drowsy when I am at work or when I am at my school or college or during my off time. That is usually in the mornings. The same people who are feeling drowsy in the morning, they don't feel sleepy in the night. This is one of the common issues that people face. This is called day night disorientation or day night shift, where you're feeling drowsy throughout the day, but in the nights you're feeling very, very active. That's mostly upon us because a lot of lifestyle things that we do causes this biological clock shift in us. What is biological clock? I'll discuss later. So one of the first common problem is this, feeling drowsy in the day and not able to sleep in the night. Second one is people say that I'm not able to pay attention at work or I'm not able to be productive at work, which mostly is attributed to the last night's sleep or lack of it. That is second common problem that I see because most of my patients are working population. Yeah, and obviously the most commonest thing that every age group and any gender, any ethnicity, anybody comes is I have trouble falling asleep or trouble maintaining sleep. Even like to initiate sleep, maybe it's not a problem, or but to maintain sleep, there's a problem. Or some people have difficulty initiating sleep, but maintaining is not a problem. Um, Another common problem, which I see usually in older age group, is my sleep is broken. They keep waking up multiple times in the middle of the night and they have difficulty falling back asleep. Another complaint is I feel irritable, I feel angry, I feel moody on the nights that I don't sleep. That is again a very, very common concern that people come to me with. And one more, I'm in a small group of population who are doing shift work, do come and tell about uh, you know problems with sleep in the morning, obviously because they're working throughout the night, and mornings they have to sleep, which is still okay. And the worst situation is when you have to keep switching every fortnight or every week between day and night of work. That is even more difficult. Those people have it even more difficult with managing sleep. So these are the few common concerns that people come to me with. Now, first of all, why is sleep very important? Because some people think that I'm doing very well with just 2 hours of sleep or 3 hours of sleep. I don't need maybe 5 hours of sleep or 7 hours of sleep. Why is it important? Just understand that sleep is directly related to our mental and physical health. Also, when you look at health, you can't just think about cross-sectional health. You have to look at longitudinal health. What I mean by that is, if I'm not able to sleep in the last 1 week and if I'm doing well today, it's okay is what people think, but it's not, because this sleep deprivation is going to catch up. It's going to manifest in either physical or psychological form in the near future, or remote in the remote time gap. It can catch up. What are the different problems that can occur because of sleep deprivation? One of the first things is um, simple symptoms like multiple headaches, body pains. Women especially with lower back aches, they can get aggravated. Tension headaches can occur. Migraine can get worsened. This is one spectrum of physical conditions. Um, Other groups are psychological problems, inattention, being not productive at work, difficulty with driving, hence leading to accidents that can occur. It can worsen depression. People with anxiety, it can worsen. People who are diabetics and hypertensives and even dyslipidemias with imbalanced cholesterol and triglyceride levels, even they can have poor metabolic control if they're not able to sleep well. So much so that sleep is even implicated in causation of cancer. So this should make you understand how important sleep is. I'm not trying to scare you, but you should understand why sleep is very, very important. And why is sleep more important in the current pandemic situation? Understand that sleep empowers your immune system. People who are sleeping better obviously have better immune system. So just taking vitamin C tablet is not enough. You'll have to do a little more than that to build a strong immunity. So sleep helps you in that for sure, because it strengthens our defense systems of our body. In the blood there are cells that fight against pathogens that come from outside, COVID-19 or whatever. So that's one of the main important thing. And even sleep is extremely important for alcohol dependence relapse. I know a lot of patients who were rehabilitated from alcohol dependence, went home, maintained very, very well for almost 6 months or a year or maybe more than that, but they fell back into the dependence. They relapsed into alcohol dependence because they were not able to sleep, and they thought coming to doctor and going to the whole fiasco of treatment is even more difficult than just going to like a local liquor store and or wine store and just buy some alcohol. Uh, so sleep is one of the important things for a lot of patients who are alcohol dependent, because they keep going back to alcohol mostly for sleep, if not for the high of alcohol that you get. Also, it's extremely important in patients with bipolar disorder, because bipolar disorder is a mood disorder, and whenever you're not able to sleep well, that itself can trigger another episode, because it's a chronic episodic illness. It can be chronic episodic illness. So sleep deprivation is one of the important risk factors for you to have or not have another episode in the future. So there are actually many more things that sleep is important for, but just to touch upon the surface, these are the few important diseases that sleep is very important for. And Dr. Janaki just joined us, and she agrees with me. And sleep is very, very important for even dermatological health. It makes it improves blood supply to your skin, and makes you look brighter and nicer, and prevents a lot of skin diseases also, which I don't want to get into it. Maybe I can do live with Dr. Janaki later about sleep and skin. Um, Now, what are the common mistakes that most of us do around sleep? One of the first thing is napping. Napping is one of the common things that a lot of us do, especially homemakers, because they obviously get very exhausted throughout the day working for the family and for self in the house, and they obviously would want to rest in the afternoon. So that is one of the, if you see our mothers or our grandmothers, most of them have this habit of sleeping. Even our fathers who are retired, who doesn't have like a work schedule, going out of the home and working, they tend to take naps in the afternoon. And even, I know a lot of IT employees also, take naps. Apparently they call them power naps. Just let me break your bubble by saying that there is nothing called as a power nap. Napping is not good at all, actually. I'll explain the reason. Let me explain you what is sleep architecture first. Sleep architecture is how your sleep is distributed throughout the night, in how many, what is the time span, and what are the different stages of the sleep. One sleep cycle occurs in 90 minutes. So let's just say every 1.5 hours you complete a sleep cycle. This sleep cycle has 4 stages. I'm telling in a very like a layman's perspective. If there are doctors, just understand that this is for people to understand. So there are 4 different stages for sleep. Obviously, the first and second being the lighter stages of the sleep, and third being the deep state of the sleep, and fourth is called REM sleep. REM sleep is rapid eye movement sleep. Um, Now, to complete this entire thing, a light stage of the sleep, deep stage of the sleep, and REM stage of the sleep, it takes 1.5 hours for me. For anybody, you have to complete at least um, 4 cycles. minimum of 4 cycles per night continuously. So that's about 1.5 hours into 4 is obviously 6 hours. So minimum at least you need 6 hours. Best is to complete at least 5 to 6 stages of the sleep. That's ideal. Not even more. More sleep also causes metabolic problems, which I'll tell you later. So to complete this on a continuous basis, if you nap in the afternoon or evening or morning, whenever, what happens is you're already taking off some sleep from your sleep bank. So when you take off some sleep from your sleep bank, in the night it will be difficult for you to finish those many cycles continuously. So what will happen? You'll keep waking up in the night and you'll have trouble going back to sleep. Some of them have trouble even initiating sleep just because of the reason that they took naps, or they can have early morning awakening and they just keep rolling on the bed and tossing over the bed. This can happen, and you won't be productive next day. They say that people who slept less than 5 hours, their brain works as if they have consumed a quarter of alcohol. So you'll feel very like gloomy, drowsy, that kind of feeling is what you'll have. You won't be able to focus on anything. You won't feel very good. You'll be feeling very low. All this can happen. Now, but not all nights or not all days are same. So some days we feel very, very, very tired. So obviously we want to nap then. So then what can you do? It's okay to nap once in a while, but make sure your nap lasts only for 15 minutes. The reason being, the first light stage of the sleep happens only for 15 minutes. And if you're able to wake up in the 15 minutes, you'll actually feel fresh. But once you go back past 15 minutes, that you're entering into deep stage of the sleep, it's very, very difficult for you to get up. Even if you did with the help of alarm or something, you will not feel rested. You will feel groggy. You'll feel irritable. Check for yourself. Next time, try to sleep only 15 minutes and wake up, and you actually feel fresh, compared to 90 minutes or 1 hour of sleep where you actually wake up feeling very low and you don't have interest in doing anything. You just feel very lethargic. That can happen. So that will explain you the difference. That's very, very, very important. So napping has to be avoided, even for homemakers who are at work. Of course, if you have body pains and if you're feeling tired, you can always rest. You can lounge. You can recline, but do not sleep, because sometimes it becomes very involuntary. You fall asleep. So try to keep yourself awake. That's very, very important. Now, what is the most ideal time to sleep and ideal time to wake up? Obviously, early to rise and early to sleep and early to rise is the best way. But I understand, because we work very hard and we come home to unwind, things like that. So a lot of the people are definitely sleeping little late. Try to improve the timings, but if you can't, just don't worry about it. Make sure you are at least maintaining the sleep schedule. For example, I sleep about 7 hours, 6 hours to 7 hours. I sleep around 12 o'clock or maybe 1 o'clock, and but I make sure every night I'm sleeping at the same time. I'm not going to confuse my brain and with my erratic sleep wake schedule. So as long as I'm not doing that, I'm fine. I'm fine from sleep being a causative factor for disease. That would not occur to me. I'm hoping, at least. So that's very, very, very important. So that is about the sleep timings. When you talk about how many hours of sleep, it depends on your age group. If you are obviously, if for newborns, they sleep for almost 20 hours, and 4 hours they're up, and that time is when they're being fed. Old people, as you're aging, your sleep tends to shorten, which is very normal. Physiological reduction of age, sleep according to the age, is very normal. But what is happening? A lot of people are prematurely aging in terms of sleep. At the age of 10 years, I remember being 10-year-old and sleeping for good 10 hours, early to bed and late to rise, or maybe early to rise, depends. But now what's happening? Kids are also being awake along with the parents by watching TV or being on their PlayStation or whatever till 12 o'clock, and they're waking up at around 7 o'clock or 6 o'clock. So you're the causative. I told that sleep deprivation being one of the culprit for having multiple diseases in the future. This is what children are doing to themselves much early in their life. So it's very, very important. Another thing is when to, yeah. So talking about sleep timings, I'm considering all of you are, middle age. All of us require about 7 to 8 hours of sleep, not more than that. A minimum of 6 hours, but not less than that. More than 9 hours also is not advised, because oversleeping, a lot of people say beauty sleep, or Sunday sleeping, or weekend binge sleeping, or catching up on sleep that you didn't have for the last 1 week. None of that actually applies. You can't really catch up on sleep. It's better to rest your brain well every night, so brain will be able to produce those neurochemicals or neurotransmitters required for your functioning, optimal functioning next day. When you don't give that option, brain is not going to produce them excessively just because you slept too much on the weekend. Oversleeping is not good because it slows your metabolism. It makes you prone to a lot of metabolic and lifestyle diseases. For example, diabetes, hypertension, dyslipidemia, meaning increase in the triglyceride levels, something called metabolic syndrome that can occur in a lot of people, weight gain, poor digestion. All this can occur even with excess sleep, not just with the reduction of the sleep. So make sure you're not sleeping more than 9 hours. That is one important thing. And when to eat is another common question that I got. When to eat is, most of us eat very unhealthy. We eat half an hour before we go to bed, or maybe 1 hour before we go to bed. Don't do that. You have to eat at least 3 hours before your bedtime. The reason being, the food that you ate, it needs to be broken down. It needs to be metabolized, absorbed, and it needs to reach brain and provide nourishment for brain, so you have a good night's rest. If you don't give 3 hours and if you go to sleep 1 hour after you eat, the nutrition that you just had wouldn't have reached brain. So how is your brain going to rest entire night? It's not going to happen. So make sure you're eating at least 3 hours. But we might feel hungry. 3 hours back we ate, and now my hunger shouldn't be a roadblock for my sleep. Then what do I do? That can be a common problem. Have a fruit, have a glass of milk, have something that will make you sleep for the rest of the night. Chamomile tea is a wonderful option. Milk is a wonderful option, or having kiwi. I mean, kiwi is not very easily available in India. It is not for most of us. Kiwi, berries. You having good night rest. And in the night, don't eliminate carbohydrates completely, because your brain's fuel is glucose or sugars. If you eliminate them by having your keto diet or whatever, high protein diet or only protein diet, so your brain can't rest. So make sure you don't do that. At least have like a chapati or like a few spoons of rice, unless you're a diabetic. That is very, very important. And next thing is how light plays a very important role in sleep. um, Light and darkness will regulate production of a hormone called melatonin in our brain. It's produced by a gland called pineal gland in our brain. So what happens right now, I'm getting exposed to a lot of light because I'm doing live, and if I'm doing live right before I go to bed, and if I am going to sleep, this light would have blocked my melatonin production. So I will not initiate sleep, or I will not maintain sleep. That's the reason why you detox from your screens at least from most of our gadgets. That light spectrum has ability to retard the production of melatonin. So what happens is you end up not sleeping, which is very, very, very important. So that's about light. um, Also, I'm looking at some of the questions. Yeah, someone asked about what about pregnant women? What are the do's and don'ts for pregnant women to fall asleep? Most of the pregnant women don't fall asleep because they're asked to drink lots of water because they shouldn't get dehydrated, and this excess amount of water goes into your urinary bladder, and it puts a lot of pressure on your gravid uterus or your pregnant uterus. Because of that, they can have lower backache. Because of that, they keep getting up in the middle of the night because of the pain, or because the uterus also puts pressure on the bladder. they would want to urinate more frequently than a non-pregnant women or men. So that's the reason why they keep waking up in the middle of the night. Multiple things like that. These are the reasons. So make sure you're drinking lots of water throughout the day, and avoid drinking too much water in the night. And try to empty your bladder before you go to bed. It's extremely important. This is the first thing. Second thing is to prevent the root cause, that is your lower backache. Best idea is for you to not lie down on your back all the time, because that puts a lot of pressure on your back, and already uterus is putting pressure on your lower spine, lumbosacral spine. So you'll have backache. So what you can do is you can keep sleeping to your left side, because research has said that sleeping on the left side provides more oxygen and nutrients for your fetus. That is one. And the second advantage is you not minimizing the lower backache. So these two together works wonderful in terms of nourishing your child, and also you sleeping well, which in turn can nourish the child. Also, people with folic acid deficiency during pregnancy, because I'm sure like most of the people get their supplementation of folic acid and iron, but people who are not, it's extremely important. Folic acid deficiency can cause sleep problems, not just sleep problems, it can cause terrible things to your pregnancy. So make sure, if you're not, or if you know someone who is not getting this supplementation because they're underprivileged or they're not aware, make sure you advise them. Again, another important thing for pregnant women is burping or flatulence, or acidity. They have a lot of acidic burps because of the food they eat and things like that. So try to avoid spicy foods or deep fried items, especially closer to the bedtime. If you have any cravings, you can try to curb them in the night. Try to satisfy them through the day, and nights you're eating very, very careful. That is another very, very important thing. Also, I think not just for pregnant women, but anybody, people who are not able to sleep on the bed, don't force yourself to sleep. Maybe get up and go and try to read a book. Don't watch TV, because again that light emitted causes melatonin retardation. So instead of that, read a book or do something boring. Do some boring activity that will make you fall asleep. Right? That is very, very important. Before I move on to the next topic, somebody is asking. They say 10 p.m. to 2 a.m. is the time when your body detoxifies. Is it important to sleep those 4 hours no matter what? No, and there's nothing like that's the time for body to detoxify. Detoxification in the body mainly occurs in the liver and in the kidney, and they're working non-stop throughout the day, so you don't have to worry about that at all. But ideal time to sleep is, yes, 10 p.m. But at least in today's generation, we should sleep by 12 o'clock, if not later. So that's very, very important. And again, don't be so particular about I have to sleep at this time to this time, because your body goes through a lot of changes, especially women's. It's very difficult to just be very strict about 10 o'clock or 2 o'clock. That doesn't happen. Try to not think about it, because that itself adds a lot of additional stress to sleep. Don't do that. Again, for other people, non-pregnant women and men, one of the main important things is dehydration. When you're dehydrated, you will not be able to sleep, because understand that when I ask my patients how much water do you drink, I'm surprised that most of the people will tell me they drink, they eat food 3 times a day, and they drink water 3 times a day, especially in winters, because they don't feel dehydrated enough. But understand your body requires constant replenishment of the fluid loss equated to the fluid gain. So you need to at least drink 2 to 3 liters of water, minimum of 2 to 3 liters. I drink around 6 to 7 liters of water, but do not drink too much water if you have like kidney issues, if your doctor told you not to. But for other people, always drinking too much of water is always good. So that is one important thing. Now, talking about menopause. Menopause is women who stopped having periods. It happens between 45 to 55, or patients who underwent hysterectomy, where they have removed their uterus. They got their uterus removed, not they did. Doctors removed their uterus for whatever reasons. Them again, they'll have sleep disturbances. Mainly because estrogen and progesterone helps in production of certain hormones required for you to sleep or rest well, because there's sudden lack of estrogen and progesterone in your body. So what will happen? You will not be able to sleep as sound. And also hot flashes. Hot flashes is one of the common presentation in a lot of postmenopausal or perimenopausal women. So for that, you can, because you feel so hot instead of AC being on or instead of being in a well ventilated or cold climate, one of the first things is please wear something light. A lot of us wear thick clothes. A lot of women wear thick clothes in the home, especially if they're in a joint family and things like that. Please wear light clothes. Choose fabric that that you'll be able, that your body will be able to breathe through. That is very, very important if you're having hot flashes. Also, avoid any large meals because that can also worsen your perimenopausal symptoms. Now, another thing is about obviously exercise. People keep talking about exercising in the um, night is very good because you'll feel tired after exercise and you go off to sleep. That is not correct at all. That is a big myth. Exercise is supposed to release something called endorphins in your body, and these endorphins, what do? They make your brain and body active and alert. So you're actually putting a lot of effort trying to activate your body and again putting double effort to calm it down to sleep. So it doesn't make sense. It's actually double trouble. So please avoid exercise post 6 p.m. However, you can do like a brisk, not brisk, like a light walk, a slow walk after you eat, because you shouldn't immediately like sit and lie down after you eat. For the food to get digested and metabolized, you need to exercise a little bit. That's just 5-10 minutes of walking. That will do. You don't have to do any strenuous exercise post 6 p.m. Please try to keep your exercise before 6 p.m. Best time is in the morning, but if not in the morning, like I can't exercise in the morning because of my time schedule. So I try to work out in the evening before my hospital and my clinic. So at least you can do that. That's very important. But however, some exercises works wonderful for sleep. One of the first important things is obviously meditation. Meditation works fantastic. You don't consider it as physical exercise, but meditation is nothing but focusing everything onto your breathing. That's going to eliminate a lot of unnecessary thoughts or worries that will make you fall asleep. That is very, very important. Second important thing is about exercise, about meditation, and meditation is it improves blood circulation to brain. So more blood circulation is more oxygen. More oxygen, better sleep. So that is very important. And even in yoga, there are apparently certain asanas that will help you fall asleep well. I don't do yoga, but I tried a couple of times, but I don't know those asanas how to do. But for people who knows, uh, these it's called legs up the wall and lying butterfly. So I really don't know how to do them, but I think apparently this increases blood circulation to brain and oxygen supply and helps you sleep. So let me repeat the asanas. It's called legs up the wall and lying butterfly. Apparently these work. That is, maybe you can try that. And even pregnant women, pregnant women are made to be look so docile and not do any household chores, which is not correct. They should get their exercise. They have antenatal yoga and meditation, things like that. That will help them rest well. Before going to the next one, how seriously does one have to take dreams? Okay, wonderful question. I understand that a lot of patients actually come to me saying I'm having a lot of dreams. Now, dreams is very normal. It's a normal phenomenon. Like how I'm breathing. I mean, that's not a correct example, but dreams are part and parcel of our sleep. If you're dreaming, that means you're sleeping well actually. If you are gone to the deep stage of the sleep, only then you will start to dream. So that's very good. But the problem is, if the dreams are disturbing, if they are nightmares or night terrors, these are two different conditions which I posted on my page, you can go and check. If you have any of these two conditions that is causing arousal in you, you're waking up in the middle of the night with palpitations, with sweating or fear, and you have difficulty going back to sleep because of these dreams, now that's a problem, because that's obviously like a roadblock for your good night's rest. So that is when you have to definitely see a doctor. But otherwise, dreams are normal phenomenon of your sleep. Now, talking about shift work. Shift work is something that a lot of patients ask me that what do we do? It's very difficult because one of the major mistakes that people do after shift work, for example, today someone was asking me their shift is from 4 p.m. to 4 p.m. to 1 a.m. and after 1 a.m. they unwind a little bit, they relax, they watch like a movie or a Netflix show or something, and they tend to sleep by 4 o'clock or 5 o'clock, and then they have trouble maintaining the sleep. So they wake up again like in couple of hours and they have their breakfast and then they sleep. Now what is happening is they're they're having broken sleep, so you're never completing your so-called 3 or 4 or 5 or 6 or sleep cycles that I asked you to complete in one go. So brain will not feel rested enough. That will lead to a lot of different problems that I mentioned in the before. So I know it's very tempting to relax after your work, especially after hectic work. But please try to fall asleep, because again, when you sleep when it's still dark, your melatonin production is still on a higher scale than you sleeping in the morning, where the you see sunlight after 4 p.m. 4 a.m. and you also hear a lot of people, or your neighbors, because we all live in such densely populated areas. So avoid that. Try to sleep in the night itself. That's very, very important. And try to be active throughout the your shift work. Sometimes what happens when our shift work is not busy, or we don't have any project, or we don't have any work to do, what happens is we try to sleep wake up, which is okay. It works for some people. Napping in the night in shift work works for some people. For some people, try to be active. So try to, like, maybe take a flight of stairs, or try to do a little stretching on your in your chair, or things like that. You can do one of those. That'll definitely help. um, but if you, right now it's COVID, so it's a different situation. But for other people, if you're working somewhere else and you're coming back home in the night, the moment you're done with your work, when you switch off your computer, wear a dark goggles. We all use sunglasses only in the morning, but wear dark goggles to eliminate any kind of light entering into your eyes and brain on your street, like street lights, or other vehicles coming across, all that light, because all that light is still going to affect your melatonin production. So if you wear the goggles, what will happen is by the time you go home, your brain would have already started producing melatonin. So you'll be able to, you'll already start feeling little drowsy. So it will help you maintaining sleep. That is very, very important. And obviously it's very, very important to eliminate noise or excess light in the room. So try to have like minimum light and good temperature. That's it's understood. I don't even have to say it. So for what it's worth, you can even use eye masks or earplugs, etc. Because all this plays a big role in your quality sleep. Another question I get is caffeine, coffee intake. How bad is coffee intake? Caffeine, one cup a day is okay, because it has its own advantages maybe. But but for people who are drinking post 6 p.m., please be aware that it's very difficult for you to fall asleep. It will be very difficult for you to fall asleep with caffeine in your system. Because caffeine is a stimulant again. Even carbonated drinks, like a carbonated soda like Coca-Cola, Thumbs Up, etc., even they have some amount of caffeine in it. So please avoid any of that. I know a lot of us eat like a large comfort meal in the night and have like a can of Thumbs Up or Coke or whatever. But try to avoid it, especially if you have sleep problems. Very, very important. What is the relation between smoking and sleep? I would say avoid smoking, because the effects. It's repeatedly told in by doctors. I don't want to get into that, but especially after 6 p.m. you cannot smoke. But don't go and tell that I told it's okay to smoke before 6 p.m. That's not true. But after 6 p.m. it definitely interferes with your sleep. So that's about nicotine. I think I have covered pretty much all the questions that people asked. So if you have any questions or anything, you can please feel free to ask. Also, people who are snoring, people with a lot of body weight, on the higher side, or people with a short, stubby neck, people with respiratory difficulties called obstructive sleep apnea. It's called OSA. People with these conditions, it'll be difficult when you're snoring. So try to get yourself assessed in a sleep clinic, or you can come to me. I will assess you. So one of the things you have to do. Another simple thing is progressive muscle relaxation technique. It helps you fall asleep. So what you have to do is you start contracting a muscle and relaxing a muscle, individual muscle. It's, for example, let me start. If I'm starting this muscle relaxation process from the head to toe or from the toe to head is the best. But head to toe also works. For example, if I have to contract my this muscle, what I'm doing, I just have to frown, so it's contracting my muscle, and then I'm going to relax. I'm going to contract and relax. If I have to contract my muscle, I'm going to close hard, and I'm going to relax. So same way, I can clench, I can shrug, I can contract my biceps, triceps. I can go down every muscle, or I can start contracting my toes and go up. So this muscle relaxation will reduce muscle tension, and help you fall asleep very easy. This is very, very important. But if you have any anxiety or depression or any other conditions, PTSD, post-traumatic stress disorder, or bipolar disorder, any condition that is causing sleep problems, you will have to definitely see a doctor, uh, alongside doing whatever tips and tricks that I told you. Yeah, I think, yeah, these are a few things. And also, showers definitely help for sleep. Cold showers, unless you're like allergic to cold, you know, shower. Otherwise, it works wonderful for sleep. Yes, and a lot of people who are drinking alcohol for sleep, please don't do that, because alcohol is not a sedative. It eventually causes sleep deprivation. Even though in the beginning you feel a little tired and drowsy, but it won't maintain. So it's very, very important that you avoid. So I think these are the few things that you need to do for a good night's rest. Um, so any other questions we can take, or we can go ahead. I hope this helped, or this will help some people. Someone is asking about how to cut off your thoughts so that you can sleep. Okay, so like I told you, meditation works well to cut off the thoughts. Mindfulness works well. Mindfulness is you focusing on the moment or on a particular object. That works very well. Or distracting your brain works well. So you can probably take up a boring activity before you go to bed. Not exciting one that will keep you up. Boring activity. Like for me, like reading like a novel, yeah, I find it boring. So maybe that will help me sleep. So something like that is what you can do. This is counting sheep. Counting sheep is what our parents used to tell us when we were children. So what you can do is you can do reverse counting. You can take a random. I keep telling this for all the anxiety patients also. Just a quick review. Take a random big number. For example, I'm taking about 8,068, 8,068, 8,067, 8,066. When I'm reverse counting, a big number, my brain can't multitask, so you cannot think, you cannot have multiple distracting thoughts. So that's a way to ease your body. And I already told you about muscle relaxation progressively from head to toe or toe to head. Even that helps wonderfully for you to uh, you know reduce your anxious thoughts. I think these are a few techniques that can help you. Also, I know a lot of us, we like little dark rooms in the mornings and things like that. But don't do that, because morning your brain will have to be exposed to a lot of light for it to produce melatonin in the night. So if you are constantly in the dark, your brain will start producing melatonin here and there, and not in a good timely way. So you have to get exposed to a lot of light in the morning. It helps for a vitamin D production as well, which again is implicated in sleep deprivation, sleep issues. So that's one of the important things. Is it okay getting scary dreams repeatedly and it starts making us feel low the whole day? um, just understand that dreams have no meaning. um, Sometimes some unresolved thoughts or conflicts, they can manifest in the form of dream. You don't have to worry about it. But if the scary dream is waking you up in the middle of the night, then you definitely will have to be seeing a doctor. um, but otherwise, if you're just waking up in the morning and then you are just recollecting scary dream, it's completely okay. You don't have to worry about it. It has no much meaning. Just get up, exercise, and move on with your happy thoughts. Yes, I think that should bring us to the end of today's topic. Um, I'm hoping there are no more questions. If there are, you can obviously text me, or you can ask me during some other live, because sleep is something that we touch here and there. Thank you so much. All of you, I'm hoping you are staying safe and practicing all the precautions properly, your hand hygiene and respiratory etiquette and social distancing. I know a lot of us are in a position where we feel like, oh, it's enough now, we'll just see what's going to happen. So it gets a little exhausting to be always maintaining some things, but understand, it's a very serious thing. um, Even if you're feeling like, I want to let loose a little bit, don't. Just remind yourself that the damage you could do to yourself and to people around you. So please, practice caution. It's better safe to be safe than sorry. um, so all of you, stay safe and take care, and good night. Thank you.